Thank you. Okay, I'd now like to invite up Jeannie Di Bon from London, who's going to talk to you about Pilates. Thank you.
Thank you, Laura, and hi, everybody. Where's the... Oh, you took it? Okay. Okay, so I'm here to talk about Pilates and movement therapy. So just a little bit about me. I've been teaching Pilates and movement therapy since 2008, and I have clinics in London, in North London and South London. I've written a book, Pilates Without Tears, that some of you may have already read. And I'm going to talk to you, I also have hypermobile EDS, and I'm going to talk to you how I developed my integral movement method to help me overcome my chronic pain from EDS, and how I now use that with my clients in London. So I'm actually going to start my presentation at the end. So we're going to hear from some testimonials of some of my clients. So this is why they come and do movement therapy and Pilates. It gives me awareness and control. I was scared at first, but now I look forward to it. It makes me energized and optimistic. And we're going to talk about all these feelings. So maybe some of you have experienced being scared about actually the idea of moving and doing exercise. It gives me strength and stability. I mean, that's so important for us, isn't it? So something that makes you feel amazing and connected after a class. Pilates to me means strength and togetherness with EDS. And again, I don't know how many of you have often felt very disconnected from your body, and like your body is in control of you and you're not in control of it. These people are now saying they feel together after doing Pilates. And Pilates is my physiotherapy. It keeps me pain-free. And if I miss it for more than a few weeks, the pain comes back. So that just tells us how we do have to move, and we do have to move regularly, as we've been hearing this morning. So I call it movement therapy as opposed to pure Pilates, and we're going to discover why I call it like this. Very unique to every individual. So every single one of us would have a different approach, more or less, to how we are going to move in our movement therapy program. I believe, and this comes from my experience, my own personal experience, and then that with my clients, any system or method that we use has to deal with the physical symptoms of our condition. So all the things that we are very familiar with, the chronic pain, the instability, subluxations, stiffness and yet being flexible in many joints, flat feet, gait issues, pain on walking, all of those things we know about, but also the emotional and psychological aspects of our condition. And I think this is one thing that's often missing from many movement and exercise methods. We don't deal with the emotional side. So the anxiety, the tension, the stress, the fear of movement, that's a really big deal in EDS patients. And obviously a lack of confidence in our own abilities. You know, are we going to injure ourselves? So I came up with, through myself and through lots and lots of research over the past 10 years, my method that is Pilates-based, but it has biomechanics, so I studied biomechanics as well, and psychology. So I studied psychology as well. And I brought all of this together, so that's why I call it movement therapy as opposed to pure Pilates. So not all Pilates is created equal. Not all exercise is created equal. Not every exercise is going to be suitable or necessary, and I think that's really important. So you can see this photo here. I certainly can't do that exercise, and unless you're a gymnast or you're working for Cirque du Soleil or something like that, do we really need to be doing exercises that promote movements like this? I don't think so. Unless it's something that we need in our everyday life, why are we even promoting that kind of thing? So not everything is suitable for us. So if we're talking Pilates, there are so many different types of Pilates, and I've just listed some of them. Mat Pilates, classical Pilates, reformer Pilates. There's so many different types out there. It can be a bit of a minefield. You can learn Pilates in a group. You can learn it one-to-one. But there are lots of different schools out there, and they all have different philosophies. So I highly recommend that you do your homework first. Don't assume that the teachers are going to know about EDS. Most of them won't. So it's really important that we do interview them before we go and start working with them. Of course, it's not a replacement for any physio or any medications that you may be having, but it is an excellent supplement. So the philosophy of my method is, I believe that our approach to movement is crucial. I use a lot of visualization when I work with people, so the language we use will impact the type of movements that you make, because our language creates the feelings. And that's what the body responds to. We're a sensory organ, so we respond to feelings. So if we were to talk in terms of movement as in force, push, pull, squeeze, all of those words that I often heard when I was learning Pilates, squeeze this, tense this, it just didn't sit well with me. And I found that it was causing more strain and more stress in my body and actually leading to more faulty movement patterns. So I definitely eliminated all words that involved connotations of force, because I believe that they block the mind-body connection. And that's really where I got my no pain, no strain evolution from, as opposed to a no pain, no gain. And this is really summed up by one of my clients, Henry. So he after, I think we'd had 1 or 2 sessions, the blend of mindful and focused movement is allowing me to listen to my body again. In just 2 sessions, through visualization, along with the careful use of the body, I am very encouraged by how much I am able to release tension and bracing that has become such a common daily feature for me. And this is absolutely huge. I see it all the time, this bracing. And I believe we do it because we're looking for stability, but it's kind of a false stability because it's causing us more pain. Now, after 10 sessions, Henry is pretty much pain-free at the moment because we've removed all of that tension and bracing that he was living by. So it's really important that the visualization and the language that we use is going to help create the right atmosphere to start releasing tension from the body. But these are the sorts of things that I hear from new clients who come to see me, and you might recognize some of these. These are all very normal, especially if you've been in pain. We've been hearing a lot about chronic pain today. If you've been in chronic pain, it's very normal to have things like, pain is part of my life, I just live with the pain now. I can't do that anymore because of my pain. It's normal. I'm too tired to do my exercises. And I'm scared. It's going to hurt my back or it's going to hurt something. All very, very normal. So nothing to be worried or ashamed of if you're feeling that. But let's remind ourselves that all of these people here, they were saying exactly those same things when they first started coming to sessions. And this is where they are now. So they might have been scared, they might have been in pain, but this is where they are today. And these were all EDS people, just like me and you. So just have a very quick look at the pain sort of exercise cycle and why it is important that we do exercise or move on a daily basis. So if we start at the top in the red pain box, as we've been hearing today, pain obviously causes fatigue and stress. That's normal. When you've been in pain for a long time, you're going to be stressed about it, and it makes you tired. So at that moment, we're going to say, actually, I don't want to exercise today. I'm too tired. I'm going to just stay at home. I'm going to rest. The problem we have, the minute we make that decision, our pain is going to go up because we're going to get more deconditioned. We're going to get more fatigued. So we get into this vicious cycle, and it just spirals. So what we need to do at that very moment when you've said, actually, I don't want to exercise today, that's the moment we actually say, yes, I am going to do something. Now, we're not saying you have to go and run a marathon or, go to the gym and spend 3 hours there lifting weights. Of course, we're not saying that. But we are saying that you have to start moving. However small, it might be a 5-minute walk, might be really small, gentle movements at home, but every little step is going to help to break that cycle. And you might be thinking, well, why should I? Why should I have to do it? And there is research out there, there's just a few examples here, that really apply to us. Those with HSD and HEDS need to try to retrain or increase their muscle strength and tone as much as possible so that we can support the connective tissue. A survey back in 2016 found that 70% of adults reported having chronic pain before the age of 20. So we've just heard how we can eliminate chronic pain or certainly manage it and alleviate it through movement. And fear of movement should be assessed and managed, and it is associated with pain and fatigue. So there's that same issue coming up, the fear of movement, the fear that we're going to sublux, the fear that we're going to injure ourselves. But we need to overcome it. So I'm really a firm believer in small steps, absolutely. Everything you do will count, okay? What we're looking for is progress, not perfection. We're not looking if you can do an exercise perfectly. We just want to see that we're progressing and taking a small step. Most importantly, we're moving with awareness, and we're going to come on to that in a moment. Self-awareness, self-belief, it's going to build your confidence and your strength, and it's going to make you more resilient. And of course, pacing is essential. So as we say, we're not going to go to the gym on the first day and do 3 hours of exercise. We're going to pace ourselves by listening to our body. And all the research is telling us that exercise is good for the body and mind. But the approach is the key. So we were hearing earlier, just someone asked, should we be doing yoga? Absolutely, I don't have a problem with yoga, but it's the approach to the yoga that is important, because it's very easy to do too much and go too far. So just one quick case study of one of my clients, a lady in her 40s. She was very fit, athletic. She loved to push her body hard, very bendy as a child. She could do all the funny tricks to impress her friends. But after her children, she started experiencing dislocations after exercise and had back pain every day. She was taking medication. And she really thought that pain was part of her life. So when she came to see me, she was in a lot of pain and didn't really expect that to change too much. So after a few sessions, this is where we are. These are her words. So Pilates has changed her physical life, relearned how to move totally. She's exercising pain-free, which is brilliant. She no longer lives in constant pain. And she sleeps throughout the night without pain waking her up, and she hasn't taken painkillers for 3 years. She still does it because it keeps her fit, increases her endurance, and tones her body. And these were her words, because she did an interview for me, so she kindly let me use her words. So she said, being hypermobile, I have suffered pain and injury all my life. And it's only working through Jeannie that I've come to know a life that is physically pain-free. Through her commitment, knowledge, and care, I can now sleep, stand, walk, and exercise without pain. And I think that's the most important thing. She's basically functioning now. She's able to enjoy her life with her family without that burden of constant daily pain. So how do we do that? How do we get Sarah and the other people to a place where they can function? So as I said earlier, it is Pilates-based, but very much from a pain management rehabilitation approach. It's definitely a 360 approach. It's not mechanical. It's not about, as I said, performing an exercise and making it perfect. It works on the mind first and then the body. Like we were hearing earlier, the brain, the importance of the brain, we can't forget that when we're trying to move. And it has 6 principles or foundations. I'm just going to quickly run through each of those with you now. So I always start with the breathing, which seems like a crazy thing, but we do have to relearn how to breathe. Because when we've been in pain or stress or anxiety, naturally we're not going to breathe to our full capacity. We become very shallow. Even breathing can become painful. But the thing with breathing is it starts to build sensory awareness. Remember, we're a sensory organ. We need to build our awareness. It has a physiological impact on us, so it's really important. And the breath creates the movement. It's not move first and then breathe. Learning how your breath actually allows you to move pain-free is super essential. And it does reduce pain. It's kind of a meditation. I often teach my clients very basic meditation because the documents are, the benefits of meditation are really well documented now in research, that it can actually interrupt pain signals from the brain. So it's always part of any program that I do with people. Relaxation, it kind of goes hand in hand with the breath, because when you start working on your breath, you will almost immediately start to relax. So I had a lady last week. I saw her for one session. We pretty much started on the breath and the relaxation. She came back the second week, so her second lesson, and I asked her, well, how have you been feeling? And she said, well, I've had a very interesting week. And so she said, I actually feel for the first time in my life, and this lady's in her 60s, first time in my life, I've been given permission to relax. And I was like, wow, that's just amazing. For the first time, in almost 60 years, this lady has found that it's okay to relax. And of course, she started to feel better because she wasn't harboring all this tension in her body. So it does release tension. Holding patterns. So that's what I mean about the bracing. We often don't even realize that we're bracing to hold ourselves up. We're looking for stability. We don't even know they're there anymore. Unfortunately, they cause us a lot of pain and a lot of problems. And it starts to build your sensory awareness, and it does help with sleep, because if we're more relaxed, we're going to be able to sleep a little bit easier. Proprioception, really, really important. It's well documented that those with hypermobility lack proprioceptive awareness. So we need to build that into any kind of program. Because if we're not aware of what we're doing, of course, we've got a higher incidence of injury, maybe of subluxations, because we've gone too far without even realizing it. So awareness and control are really, really important. I encourage my clients to explore range of movement. So I often use bands and balls, and I also use the Pilates studio equipment. I don't know if some of you might be aware of reformers and all the studio equipment you get in a Pilates studio. Initially, we start off with a really small range of movement because I need you to start to feel that control. Once you've, and that's not forever, because of course we don't want to restrict your range of movement forever, but until you've learned how to control the range and the joint, we don't want to go end of range, okay? And this does reduce pain because you're starting to build control and stability around the joint. Then we move on to joint stability. Notice now that I'm no longer lying. I've came off the floor. I'm now in a quadruped position, much more challenging for those of us with proprioceptive deficits. But here we start to challenge that awareness. Have I got awareness? Have I got core control? Have I got that ability to protect my joints? So it's a very gradual thing. It's not like we would never start off in this position. We would always start off on the back because we're going to get lots more information from the ground. And just at the bottom there, start at the ground and work up. I always look at people's feet. So I love feet. I look at feet because they have such an influence on everything else that's going on in the body. They are like your foundations. So we know that flat feet are often a problem with hypermobility. Unless you were born with a structural problem, the only reason you have flat feet is because the connective tissue has been allowed to become so deconditioned that the muscles have allowed the bones to collapse. That's why we have flat feet. So the muscles in the feet are like any other muscle. We just train them, and we start to rebuild the structure of the foot. So that will help hugely with gait and with pain in, right the way up to the shoulder. Balance, so now even more challenging. This is going to come towards the end of any kind of program. I would never start you off here. Obviously, it's essential to our everyday life. The act of walking is an act of balancing. You have to be on one foot for a microsecond every time you take a step. If I'm not happy about being on one leg and doing this kind of thing, how am I going to walk with confidence and without a walking aid? So really, really important. It's stability, it's strength, and of course we have our strong integrated feet. And then finally, posture. And it's not something that I believe we can actually teach, because if I told you to all stand up now and stand up tall and fix your shoulders and, you know, lift yourself up and assume what you thought was a good posture, to me that's just a mechanical fix. Your body is going to be tired after 2 minutes. You'd go, oh, I can't do that anymore. A bit like we were hearing with the Alexander technique, we get fatigued and we just hang back into our favorite posture. So we can't teach you to how to stand. What will happen is your posture will emerge when you start to put all these elements together. Your body will start to sense the ground underneath it, and you will get this ground force that helps you support yourself. So it's a body awareness and it's an integration. Biotensegrity, the little model that Anne was showing you, that really is how the body works. It's expanding in multiple directions without having to put any pressure on your joints. And the great thing is it lasts forever. It's because we've been dealing with your nervous system as opposed to teaching you exercise. And so it's going to last forever. It just becomes part of who you are. So here's a list very briefly. I could have written pages and pages, but some of the benefits that you might experience: strength, control of range, improved muscle control, muscle tone, less pain, injury prevention, improved breathing, a dynamic posture with stamina, good tension in the body, so that's that biotensegrity, that ability to hold yourself up, overall quality of life, energy, vitality. And of course, when you're moving more and you're getting about more, your confidence and your mood and your stress levels are all going to improve, which is going to give you a better sense of well-being and calm. So it really is a 360-degree model. And really nice, the community and support. So if you're going to a class or a teacher who really gets you and you look forward to going, you're going to start to feel that support network instead of those feelings of isolation that we can often have on our own. And as I say here, I really see this as an adaptable base that allows you to then go and do the things that you want to do, you know, sport, everyday living, gardening, playing with your children, whatever it is. This is with you forever. So it's really, rather than an exercise, it's a way of life. Now, just very quickly, I'm always asked about stretching and whether we should be stretching. That's like the number one thing I get asked. Is it a good or a bad thing to be stretching? In my opinion, yes, we are stiff in certain places. We all feel that stiffness and that desire to stretch. So we're stiff for a reason, though. So those muscles are stiff because they're desperately trying to stabilize for all the ones that aren't so toned. So if we then go and stretch and stretch and stretch because it feels so good, is that really a good thing? Because you're going to destabilize an already unstable body. So I don't recommend pushing or forcing into stretches because it can actually cause pain afterwards. We can actually go too far without realizing it. And to be fair, nothing will actually change because you will stretch and stretch and stretch, and then the muscle will just pop back and it will just feel stiff again. So dynamic stretching, however, I highly recommend. And that's where you don't hold a stretch, you move gently in and out of the stretch to facilitate moving that stiff area, but without forcing it. We want to build elasticity in our body, not just a more stretchy body, because we're already stretchy enough. So, final thing, if you were to leave today and think, what should I do? This is sort of what I call my stage one. These are the things that you should be building into any kind of movement program. Closed chain exercises. So the picture at the bottom is more open chain, obviously very challenging. Don't want to start with things like that. You haven't got much support. You haven't got much contact with the ground. Closed chain. Short range of movement, as we were saying earlier. Don't go wild and do your end of range just because you can. We need to rein it in. Build on the motor control. Make it simple. You know, with the lack of proprioception, if you start doing all sorts of crazy movements, you're going to get lost. Slow, very slow. The slowness builds the sensitivity in the body, so keep it slow with a few reps. And if you're happy with somebody, if you're working with someone, you're happy for them to touch you, tactile feedback is fantastic. So if you're happy to someone get their hands on and allow you to feel things, even better. Build your sensory awareness. Keep the loading very low to begin with, so don't go and start lifting 20-kilo weights on your first day. That's not a good idea. You want a combination of isometric and eccentric muscle loading, so holding things, but then also allowing them to lengthen. Limited change of position. I think that's really important. If you've got POTS or dizziness, you don't want to go to a class where you're getting up, getting down, twisting around. Keep it really simple. Consistency, little and often, and work with someone who understands you, who you get, so you can get that education and trust. And yeah, that's it. Oh, and check with your medical practitioner first if you're going to start any new exercise, just to be sure they're happy. And that's it. Thank you very much.